the redistribution of health. I want to talk about that. There's been a lot written about wealth redistribution ever since Joe the plumber accused Obama of doing that, and several articles recently about how Obamacare redistributes wealth, and many other of the administration schemes do likewise. But the more significant defect of Obamacare is not that it redistributes wealth, that can always be replaced, that it redistributes health, which once lost really often cannot be replaced. What Obamacare does is that it takes health care away from some people and gives it to other people. So if, for example, you're a cancer patient and your health insurance now says that you can go to Sloan Kettering, or one of the top cancer hospitals in the United States, the Mayo Clinic, or Cedar Pines in California, you're going to get high quality, incredible, cutting edge, almost experimental care, and will produce miracles in terms of survivability of cancer. Many cancers have been basically, in effect, cured as a result of that. But what Obamacare does is it says, no, you can't go to those hospitals because they're not in your health plan. And those hospitals tend not to be in any health plan. If you get cancer, you're going to have to go to your local community hospital, where you probably will never see an oncologist. You'll be lucky if you see anybody other than your primary care family physician, who has a very limited knowledge of how to treat this disease. And only certain medications are covered for it, others that are outside your plan are not. And we're going to use the money we save from that to subsidize the health care of other people who are uninsured, to give them at least a basic access to health care. It amounts to really a dumbing down of health care for one's population and raising it up for another population, so that essentially we are redistributing health care from one group to the other. One of the ones that will suffer the most are the poor and the elderly. The poor, because doctors are increasingly refusing to take Medicaid patients. Almost half of the doctors in America now won't take them. Well, it's one thing to say, hey guys, we're going to give you free medical care. It's another to tell you, but sorry, you can't see a doctor because nobody will take our low reimbursement rates. And in Medicare, the same problem may be coming because they're tending to follow the Medicaid reimbursement rates. And the cuts in Medicare are built in to the Obamacare schedule over the next 10 years. They're just about to begin coming down the pike. So all of this amounts to taking away from some people and giving to others the gift of good health care. Now, of course, the answer to all of this is to realize two fundamental things. One is the United States is getting older, slower than the rest of the world, but we still are. And the population of people over 65 grows at the rate of 10% a year in the United States, whereas our population grows at only 1% a year. So as we get older, obviously healthcare costs are going to increase, and it's fatuous to believe we can hold them down. We can't. And secondly, healthcare is going to become more expensive because there'll be new technologies and new medical breakthroughs that we'll expect to share with people. 20 years ago, we didn't have to worry about giving everyone a heart transplant. We didn't know how to do it. Now we do, and we want to redistribute that capacity so that anybody with a bad heart can get a heart transplant. So as those two trends happen in science and in demographics, and on the other hand, the politicians try to hold down the cost and redistribute the resources we have, we're ending up with a system of redistributing healthcare, taking it away from some people and giving it to others. Now, why do you and I work? Why do we make a living? Why do we get out of bed in the morning? It's not so that we can eat at fancy restaurants or have a yacht or have an airplane or something like that. It's so we can provide for our family. And what is more important in providing for our family than healthcare? It's the most fundamental reason for working, for making money. And here Obama is detaching that from the benefit. You'll work, you'll make the money, we'll tax it, but it can't buy you health care. It can't buy you security for your family. If your wife gets sick, hey, the income you make isn't going to help her, or vice versa. And with that, you're undermining the very concept of protecting your family, taking action to protect them, and the linkage between work and at least physical health safety. Thanks for watching.